I think the first topic really has to do with the increasing inequities in health that we see around the world, both between countries and within countries. While some countries have managed to diminish the inequities in their country, for example, Brazil, I think, is a prime example where there's a emerging middle class, we still see major inequities within populations, and I think that has a tremendous impact for health. And this has become exacerbated by the current financial crisis, for which there's not an end in sight, at least not in the near future. So that has affected not just that the inequities have increased, the gap has widened, but also the ability of the state to respond to these inequities has become much more difficult, because there's more people who are in need of services, and at the same time their ability to fund that has been around forever, and I think is becoming more and more at the forefront, has to do with migration. And people migrate for numerous reasons. You know, it could be war, famine, economic opportunity, family reasons, medical tourism is growing, et cetera. And regardless of the reason, what we're seeing is more and more populations migrating to other countries. So what happens with that in terms of its impact on health is, for the countries that receive these populations, it does create a strain on the health services, because quite often they already are trying to meet the needs of their own population. But then there are the migrants who they also really need to attend to as well, and it's very important. Migration also can bring with it an increase in the rate at which communicable diseases are transmitted, and that's a very important issue. And I should stress there that when saying that, I definitely want to say that it's multi-directional, this transmission of disease. It's not always coming from the migrant population to the recipient country, but it can go both ways. And also that migratory flows are multi-directional as well. So that's not, when someone goes to another country, they don't necessarily stay there. They're going back and forth quite often between their original country and their host country. Also, there's an impact on chronic disease with migration. Why? Because people, when they go to a new country, they often adopt a different lifestyle. And those lifestyles can have implications for changes in diet. Sometimes it's a more sedentary lifestyle. There's multiple reasons, but ultimately it has an impact on disease, and it can have an impact on chronic disease. And I think another factor related to migration that we don't talk about, but I think really does have an impact on health, has to do with discrimination. You know, people go to other countries, they are coming from different faith backgrounds, different cultures, different races, different color, and they aren't always as well accepted in the new country as one would hope. And that has an influence on how they're received. It has an influence on how services are opened up to them, what services are provided, et cetera. And finally, in relation to the country that they leave, there's a loss. You know, if we're talking about migration of human resources in health, we know that there's a huge migration of doctors, nurses, and other professionals to other countries. It creates a huge brain drain. It has a large impact on the health services of the countries that they leave, while the other countries are benefiting from their services. The third issue that I think really is very important to bring out has to do with conflict. And when one talks about conflict, I think we think most often of the large conflicts. We think of Afghanistan, we think of Iraq. But there's many conflicts occurring in and between countries. And these create tensions. It has a huge impact on the populations that are directly involved in that conflict. Obviously, death being the ultimate, as we would say. But there's an impact in terms of, you know, the issue of landmines, people who are just going about their daily business and lose their limbs when they're out looking for water or whatever. It has an impact on the services that need to be provided, because the services in the country are often geared towards addressing these problems with the conflict and less towards the needs at hand. It has an influence on the opportunities available to these people, the economic opportunities, the educational opportunities. People don't necessarily leave their homes because of fear, because of bombs, because of real things that are going on. And so this obviously is going to impact their opportunities to have a lifestyle for which they can attain a certain standard of health. And also the sanctions, because with these conflicts, sometimes conflicts aren't just so explicit. There's many indirect forms of conflict, and quite often economic sanctions on a country, they're going to have a huge impact on the population of that country. And so ultimately, I think that the whole issue around conflicts, creating displaced populations, and all of the issues that entail is a huge topic that really needs to be addressed and is at the forefront currently and in the future.
Annella, many thanks.
Thank you.